Hey, I'm Dr. Jesse Schultz. I'm a chiropractor in Spanish Fort, Alabama, and today I'm going to talk about 3 reasons why you might be suffering from chronic neck or back pain. So obviously there are a lot of things that can contribute to chronic pain. These are just 3 things that I see come up really often in practice. So the first thing that I see over and over again is dehydration. If you're not drinking enough water, your body is going to be irritated, it's going to be inflamed, and it's more than likely gonna lead to some chronic issues of some sort. So when it comes to water, rule of thumb, try to get 1 ounce of water for every 2 pounds of body weight every day. So if you weigh 200 pounds, 100 ounces of water is a great place to start. So hydration, huge deal, I can't stress it enough. Oftentimes thirst actually masquerades as hunger. So if you find yourself hungry often and you're not drinking enough water, that's something to look into. Your body might actually be asking for water when you feel hungry, not food. The next thing that I want to mention is posture. Now, I'm talking about standing posture, seated posture, posture that we use while we actually work, and sleeping posture is actually a really big deal. I recommend all of my patients get a good pillow, a good mattress. Sleeping on your side is probably going to be the best bet to keep your spine in a nice neutral line while you sleep. Posture is a really big deal. So making sure that we're keeping our chin tucked back, our spine as neutral as possible when we're seated, things like that. These can be a big influence on chronic pain. You know, if we're constantly hanging our chin forward or slumped or in poor posture, that's going to put a lot of stress on the structures of the spine. The third thing that I'm going to talk about is stability and mobility. Okay, so stability is the strength of the spine itself. How strong are the muscles around the spine? How stable does your spine stay when you move? Mobility is kind of the opposite. It's how well does your spine move when it needs to? Does it turn the way that it should? Does it side bend the way that it should? Does it flex forward and extend backwards? These are things that I really dial in on when I'm working with patients in the office because more often than not, there is a stability issue and or a mobility issue in the spine. And so chiropractic adjusting is a great way to help increase the mobility of the spine. And then progressive rehab exercises are a great way to increase the stability of the spine. And so those are things I really do like a deep dive on when I see patients in the office. So those are 3 things that I see over and over again: hydration, posture, stability and mobility of the spine that could be contributing to chronic pain. 3 things to keep in mind. 2 of them you can work on your own. Obviously, I always encourage you to go see a chiropractor to get your spine checked out, get a professional opinion on what could be contributing to your pain. So I hope this has been helpful, and I hope you have a great day. I will see you next time. Thanks.